Muscle pain and nerve pain may both feel uncomfortable, but they are very different conditions. Muscle pain is known as myalgia, while nerve pain is called neuralgia. Though both are types of pain, patients often find it difficult to understand the difference. The key distinction lies in the nature, location, and behavior of the pain. Muscle pain is usually localized. It stays in one specific area and does not travel or spread along the body. The causes of muscle pain are also easier to identify. For example, someone may feel muscle soreness after doing unusual or intense physical work. A direct injury, such as a fall or a blow, can also result in muscle pain. Nutritional deficiencies may lead to muscle twitches. Muscles can cramp, become overstressed due to repetitive activities, or become inflamed due to overuse. These issues usually remain limited to the affected area and often improve with rest. Because the pain stays in one place and its cause is generally clear, such as lifting something heavy or performing a repeated motion, it is easier to diagnose and manage. Nerve pain, on the other hand, behaves very differently. It is usually sharp, shooting, or electric in nature, and it tends to radiate from one area to another. A very common example is sciatica. In sciatica, the pain may start from the lower back, travel through the hip, move down the back of the thigh, reach the calf, and even extend into the ankle. This radiating pattern is a hallmark of nerve-related problems. Nerve pain is also often accompanied by sensations such as numbness, tingling, or the feeling of ants crawling on the skin. These symptoms never occur in muscle pain and are clear indicators of a neurological issue. Tingling and numbness may occur because a nerve is being compressed, irritated, or is not functioning properly. This could happen due to a slip disc in the spine, diabetes-related nerve damage, neuropathy, or other neurological conditions. For example, if someone experiences pain radiating from the neck into the arm, this could indicate a cervical disc problem rather than a simple elbow or shoulder muscle issue. Another important distinction is how the pain behaves with movement and rest. Nerve pain often worsens during activity and reduces with rest. For example, walking may intensify sciatica, while resting may relieve it. If someone continually uses a limb affected by nerve compression, the limb may become numb or weak. Muscle pain, however, usually improves with rest and does not cause numbness. In summary, muscle pain stays in one area, is often related to injury or overuse, and does not cause tingling or numbness. Nerve pain radiates, feels sharp, and is commonly accompanied by neurological symptoms such as numbness, tingling, or weakness. It often results from nerve compression or dysfunction. Understanding these differences helps identify the true cause of the pain and ensures proper treatment.